Happy Monday, folks. So, today I want to talk about health insurance in America, especially if you have a high deductible health insurance. I got a first hand experience today. Well, this is my first year having a high deductible insurance from my company. Before this, I was on TRICARE under the military system, which is not too bad, right? But it's insurance companies, they still have their confusing parts, like what is covered, what is not covered. So, if you follow my channel, you know that I just retired from the military after 21 years of service. So, because I'm a reservist, so I'm no longer qualified to get on TRICARE, and my disability is not high enough to get any VA hospital care at all. So that brings me here. I'm using the insurance that is offered by my company. Is a high deductible insurance. So what that means is that there's a high deductible for the family. So I have a family of 4. The premium I'm paying right now, including dental and vision, is about $850 a month. So I don't know about you, but that's a big chunk to me. I mean, yeah, it does cover the whole family, but for $850, that's quite a bit. So I got promoted also this year, well, last year. That's the same year as I retired from my military, but I'm getting my take-home pay is much lower after I get promoted because I am no longer using my military insurance anymore. So I have to go into the real world, right, to use the insurance that's offered by my company. Yeah, it comes out to be my take-home pay. It comes out to be even lower before I got promoted, but that's unfortunate, right? So I took a look at the deductible amount. It was I think it was like $12,000 a year. So what's that mean? So that means that if I go to any like special care, like last month I went to the foot doctor because I have foot pain. Yeah, so that cost me $400 just for a visit, right? Do like maybe 2 X-rays on my feet. That's $400 right there, and it's not covered by insurance because I haven't reached my deductible yet. And I have neck problem as well. It's been bothering me chronically. Last time I had a flare up on 3 months ago. I was having a hard time sleeping with my neck, and then I was not able to move my neck at all for 2 months. And then after that, it still has pain right now, and I start feeling like feelings on my arms, my fingers. So I see my doctor, right, with the new insurance. Luckily, I think it's considered a routine meeting with my doctor, so it's free, covered by insurance. That's cool. So he recommended me to go to this physical therapy with my neck. So with TRICARE, with the military insurance, it covers a big chunk of it. I think I pay like $25 copay every time I go. But with the high deductible insurance, the healthcare insurance I have right now, it's $87 out of pocket every single time. So I'm supposed to go twice a week for I think 8 times total, so 4 weeks. So 8 times 87, that's about $700 that's coming up to my bill. Yeah, that's the bill I'm looking at right now. It's just not fun, right? So what do you guys think about the high deductible health insurance? Do you guys use it often? Like, do you recommend it if you have a family? I'm turning 40 this year. I have pain all over my body, my neck, my feet, my wrist, my knees. I've been through a whole bunch of physical therapists last year. I was lucky because I have TRICARE. Right now, after this physical therapist session with my neck, I'm not sure if I want to go back anymore. Like, even if I have pain, I might just power through. It's causing a lot of stress, financial stress, right? The financial stress is no joke. It breaks me down. Yeah. And I cannot opt out of this option because I think the company also offers some low copay options. I might change that to the low copay option next year. Even the low copay, the deductible for family was like 4,000 or something. It's pretty ridiculous, right? With the high deductible, I am able to open a HSA account. It's the health saving account. I mean, you can put like pre-tax money in there to lower your tax liability. It's not that much. So pretty much I'm using pre-tax money to pay medical bills until you reach a limit. Yeah, I'm not sure it's worth it or not. What do you guys think? Do you guys have like HSA with family of 4 or more? Do you think it's worth it? And like, how do you guys deal with this medical bills piling up? I had medication last week. The doctor put me on steroids for my neck pain, my foot pain. Had allergy meds all together, and some gout medication as well. So altogether, it cost me about $200 just for medication. Yeah, it's not cheap to live in America, especially with family. Like, I hear people like around the world. It's not just America. Like, people are not having kids. Maybe, some poor country, they still make a lot of kids, right? But I know that in Korea, South Korea, in China, in the US, and lots of parts in Europe, throughout Europe, people are not having kids because the cost that comes along with it. In America, we are lucky enough that we don't have to pay for school. If we can use a public school here, but you guys still save for college, right? And Yeah, and the health insurance is it's just like it's just ridiculous here. Unless you have a job that that pays for most of it. I think for a single person, right? Here's the thing: for a single person, your health insurance is a lot lower. At least if you have a job, most of your company will either like pay most of it, or you pay a really small premium every month. I check my company; I'm paying like maybe $200 a month for if just for myself, right? But paying for the whole family, it's quite a bit. I mean, think about it, it's like $850 for the whole family, right? Yeah, I don't blame. I don't blame nowadays people doesn't want to have kids. Yeah, let's just let human distinct. You know. Today's a nice day out, so I'm just probably work my day work and in the park right here. So yeah, let me know what you think about the insurance in America. House insurance, property insurance, right? And car insurance. I think currently I'm paying 175 for my car right now. I don't know, man. I think most insurance is a scam, especially health insurance. I mean, the the medical industry in America, man, is really scammy. My dad, he's in his 80s. He has to take those shots for his gout. I think every 2 weeks, and he told me that when he see the bill is, I think it's like 30 grand to 40 grand a shot, and he has to take it every 2 weeks. And for lucky enough, he is covered by the Medicare system. Fortunately, he doesn't have any assets at all, so he's covered. But to think about it, one shot for 30 grand, like, I don't think that's legit, man. It's like the medical system is messed up.